Hello and welcome to our dental schools panel. My name is Enrique Hasso, and I am the director of the Texas Medical Dental Schools Application Service. And I'm very excited to welcome three of our four dental schools today to address your questions about applying, preparing for, and just gaining a little bit more knowledge about the dental profession. So, before we get started with some introductions, I just wanted to welcome each of you. For today, our session is going to be a little bit different from what we've seen in our application workshops. The way that this will work is that you are welcome to post your questions in the comments, whether you're watching us on Facebook or on YouTube. And as your questions come in, we will moderate those for our member institutions to address today. We also have a bank of questions that have been collected by our Team DSA support team with Suleima, who is joining us today. And so we're going to go ahead and send her off into the background and allow our member institutions to go ahead and introduce themselves. Sid, would you mind kicking us off?
Sure, I'm happy to kick off. We are the baby of the group. Not only am I the baby of the group, but our school is the baby of the group. So we are the Texas Tech Hunt School of Dental Medicine, and we are the first school in Texas in 50 years. The last school was San Antonio, so we're excited to be able to be opening up. I think one of the couple of the highlights of our program has to do with the integration of our curriculum, as well as the early to clinic, working on patients. And then we also really focus on society, community, and the individual, and teaching students how to deliver culturally sensitive care to our patients. So I'm happy to be here and happy to work with our other deans. And this year we are taking in 60 students. Our first year was 40, and next year we will be taking 60, and we will stay at 60. Enrique, we can't hear you.
Dr. Lemke, would you continue, please?
Sure. So I am Dr. Kelly Lemke, and I am the Director of Admissions here at UT Health San Antonio School of Dentistry. And we used to be the newest School of Dentistry. About 50 plus years ago, we were founded. But of the Directors of Admission, I am the newest. I replaced Dr. Kay Malone this past February. And so very grateful for my other admissions colleagues for leading the way. A couple of features of our school here are as similar to SID, our integrated curriculum. Our first 2 years of coursework focus on foundational material and basic science that are taught in the context of oral health and oral disease, as opposed to standalone topics. And secondly, we have a large clinical enterprise encompassing all of the specialties here, which is a great opportunity for our students, as well as a lot of external rotations, both in San Antonio and throughout South Texas. Thank you.
Thank you. And last but certainly not least, Dr. Miller.
Yeah, thank you. I'm Dr. Barbara Miller, and I'm the Assistant Dean of Recruitment and Admissions at Texas A&M College of Dentistry. Soon to be called School of Dentistry. You'll notice that starting in the fall. We are located in Dallas, Texas. That's one thing that's unique, I guess, about our school. And we're part of Texas A&M Health Science Center. We have different focuses here: clinical dentistry, of course, research, and community outreach. So our students have an opportunity to have experiences in all of those different areas. We also have an integrated curriculum, and we have opportunities for students to do external rotations, like to external clinics around the Dallas area. One thing that's a little different about our school is in the required courses, we require 18 semester hours of biology rather than 15. And we'd like for you to include anatomy, physiology, and microbiology in those 18 hours. And we've been taking 106 students every year, and that's what our plan is for next year. Thank you.
Excellent. Thank you so much. And now that you know our panelists here, please drop in your questions. Don't be shy. We are here for you. As questions are coming in, we are actually going to pull from our pool of questions that we receive here at TMDSAS. The first one is in general for the entire group. For prospective applicants, which activities, internships, shadowing experiences would you suggest help applicants gain the most experience and help create a more competitive applicant?
Yeah, so I guess I'll start. I think just like your regular shadowing, kind of traditional shadowing is the best and most available for all the applicants. Those kind of internships, and like especially a general dentist's office, although we also like to see some shadowing from specialty areas as well. I think it would be hard for people to actually, for everyone in the applicant pool to have worked in a dental office, but those that have that opportunity to work as like a registered dental assistant, that's helpful. And when you're shadowing a general dentist, it's also helpful to do more than one shadowing, more than one office, more than one general dentist. So that's what comes to mind to me.
I'll add on to that. I second everything that Dr. Miller said. I would like to add also that we like to see membership in a pre-dental society, which is very common because most of our applicants are coming from campuses where there is one. Obviously, if you're at a small university, that does not have one, that's, different. But if we are aware that there is a pre-dental society and the applicant has chosen not to either join or report on their application, that kind of makes us wonder why they didn't, because it's such a great way for applicants to learn more. Because for instance, here in where I'm standing in San Antonio, UTSA has a great pre-dental society. They have speakers all year long. They have hands-on opportunities for students to volunteer. And so just as a plug for pre-dental societies everywhere, I think that's such a great way for students to show that they really are delving into their intended career. So.
Yeah, and I'm going to, triple all of that. But what I can add is I think it's important to really focus on sort of experiences that allow you to interact with other individuals in lots of different formats. As a dentist, you are working with people. And so whether that be you working at, maybe in your working part-time in school, you are working with customers at a restaurant. I think everybody should have to work in a restaurant, just if you ever intend to deal with people in the future, because that's probably the hardest place to deal with people. But I think that all of those experiences can give you insight into yourself and how you are able to learn from those experiences and grow from those experiences.
Thank you. And we have our first question here from one of our folks on. Dr. Lemke, I think you've mentioned in the past that medical volunteering is highly encouraged for applicants. If we do not have medical volunteering, will this be a big determinant of not being accepted?
I can only speak for San Antonio. So on right there on our DDS application page, under our minimum standards for admission is volunteering, or what we call community service, and it specifically states health related. But the definition of that is broad, and so Bree, like it doesn't have to be medical, like chairside assisting kind of volunteering. It could be something related to health, like a broader thing, like helping out in at a food bank, or maybe at a nursing home, or something maybe in a homeless shelter. It doesn't have to just be hands-on delivery of medical services. So our interpretation of that is more broad, but that is definitely something that we look closely at. And so our application page, again, it just says community service health related. So hopefully that answers the question.
If I could butt in real quick, on the TMDSAS application, of course, there are 12 different categories of how your activities are entered.
Mhm.
And so you do have the community service section, but you also have the healthcare activity section. And so healthcare activities would be any activity where you have direct observation of dentist patient observation or supervision. And so that's the distinguishing factor is whether you are in direct observation of a dentist working with patients, or are you volunteering kind of in the background of the dental office? So that's typically one of the big questions that we get at TMDS is how to differentiate those. And at the end of the day, you all know your experiences much better than we do. So categorize your activities as best as you see fit. And we're including a link to one of our articles about how you can categorize those activities. Next question. Will research make an applicant stand out, specifically if the applicant has a degree in biomedical engineering?
So I'll go ahead and answer that, at least start off answering that. I think that there's a fallacy out there that there's one thing that makes you stand out in your application. And I think you need to be really careful about that. Again, that can be a great thing, having a degree in biomedical engineering. It could be something that isn't particularly favored, depending on you yourself and how you've used that degree and the experiences you've had. So I think it's really important to have a passion for whatever it is you're doing. So if you majored in biomedical engineering, what was it that was passionate about that particular major for you? And then how is it that you kind of transferred into dentistry? Did you just not like biomedical engineering, and so now you're just going to try something else? Or what was it about your experiences that brought dentistry to the forefront? And then I think it's also important to highlight, how you feel your biomedical engineering background would be helpful in your new career or in moving forward in that career.
Yeah, I was just going to add something about research in general. The way we look at that in Dallas, research is an extra thing. We don't look at it as required at all. Some students enjoy research and they do it in college, and of course we think that's great if that's what you like, if you want to do it, but don't feel like you have to do research just to stand out or add something to your resume. Oh, I don't have research on my resume or whatever. So yeah, it's not for everybody. It's just an extra thing. And it doesn't take the place of shadowing dentists and doing volunteer work or community service with people. It doesn't take the place of that. It's an extra kind of thing.
I think in a similar vein, I'm sorry, Dr. Lemke, were you?
I was just going to say that our school takes a very similar view to Dallas on research, and I noticed that there was one additional question in our comments on our end about research, and the student was asking how much detail they might need to know about the topic for their interview. And speaking only for San Antonio, we in my experience would not be grilling an applicant on the research. We might ask them like their level of participation in the project would be more of a thing that we would consider appropriate for an interview.
I think in a similar vein, we have another follow-up question about activities specifically. How does admissions view working as a dental assistant? Is something that you would look for?
So I'll go ahead and start. I think that, I think it's great to work as a dental assistant. But again, I think you have to be really careful that you assume that working as a dental assistant is what's going to get you into dental school. So if you take a look at your application holistically, and maybe you are working as a dental assistant, but your grades maybe suffered somewhere along the line. And so for us, one of the things that we really look at is we do look at a proven record of academic performance. And I'm going to guess that all of our schools do the same thing. And so you can be working as a dental assistant, but your academic performance was poor. And so again, working as a dental assistant is helpful, but it doesn't make up for the deficiency in your academics. That being said, a lot of times we see dental assistants and they never go back out again into other offices. And for us, we really like to see you continuing that work into other offices. As a dental assistant, you now have access almost to more dentists. And so it's really important to just get a global view of dentistry. And that's what it's about by going to the different offices.
And I think we're dancing around the concept here of holistic review. And so, with having a specific area of the application where someone might be stronger in, but another area that needs a little bit more improvement, I think that's essentially what we're talking about here. Because we have another question kind of along the same pathway here. And this is getting us into that conditional territory of what if. If a student has a low BCPM GPA for undergrad and a high post-bac or master's BCPM, does that student have a realistic chance of getting an interview or offer admission? So if you could find a way to say the same thing a third time here with regards to GPAs.
I can maybe address this question. And again, I'm just thinking from like a real example from a recent application cycle. We did have an applicant, a reapplicant, who had a low, not markedly low, but less than competitive undergraduate BCPM GPA. And this, my answer may actually address multiple other questions, but he did very well in his master's program, and he skipped a cycle on applying. So he applied and then reapplied 2 cycles later, having completed the master's. But he checked other boxes. So in addition to having the master's, he did additional shadowing, like steadily between the 2 cycles. He, and I believe he also worked in a dental office. So when it came time to looking at that applicant, we were like, well, what else could we ask from him? He really stood out in the way that he improved himself. So if from my standpoint, that's not necessarily a deal breaker. We would be looking at it holistically, I guess you'd say. So, and my fellow directors may have more input on that. So.
Yeah, I totally agree. And every year we have entering students in this kind of situation where they had a lower, like, maybe even around a 3-point kind of GPA, and but they did a master's program or a post-bac program and had a much higher GPA from that program, more like a 3.7 or something like that, or better. And like Dr. Lemke said, they had the whole everything, that we're looking for: the shadowing and community service and working in a dental office and an improvement in the GPA, and I think even improvement in their DAT scores. So so it's not a lot of students every year. I wouldn't say it was a huge percentage, but a pretty good number, maybe 10% or something like that of the class is in this situation. So that's what I would add.
And I'm just going to add one last thing is I think you have to define what low means. What is low? We can all kind of, look at it in a different way. But also I know A lot of times students think that if I don't talk about it, nobody will notice my low GPA in undergrad because my other GPA was higher. But I think if it's a low GPA, I think it is important to be able to explain what happened. I think we all know that life happens. And if you're lucky enough to have been able to apply to dental school and never had life happen, then that's great. But what we need to know is that how are you going to handle things if you get into dental school and something happens that life gets in the way? How are you going to handle that situation? Because we do know that life does make it difficult, but I think it's worthy of an explanation.
And with regards to the explanation, of course, secondary application that you would fill out as a dental applicant would be a great place for those that are applying to Texas A&M. And in addition, we have the optional essay as a place to directly address any areas that you think might raise any eyebrows in review. I did want to point out a few resources that we've shared as the conversation has led us in this direction. There's a link to an article with regards to the upward trend of your GPA and how that comes into play in holistic review. With TMDSAS, we calculate over 100 different GPAs, and these are available to our member institutions, whether it be your freshman year biology course GPA or your entire post-bac GPA, your BCPM, undergraduate GPA. There are just so many different combinations. And so with this article, we aim to kind of clarify how quickly it is that the schools can notice that upward trend in your GPAs between low undergrad versus a more competitive graduate or post-bac GPAs. And also, we just shared a link to the application statistics. This is a dashboard that we've created that includes the past 10 years of data for each application cycle. And you can actually go through and kind of take a look at the makeup for the pool of applicants that have received an interview from our dental schools, the pool of applicants that have been accepted and later matriculated or enrolled to dental school. And so that gives you an idea as to what the overall makeup is for those pools. And don't use it as a way to cut yourself out of the pools, but rather as a way to give you a goal to strive for and kind of identify where you are in that area. Of course, it includes not just GPAs, but also DAT, perceptual ability, and academic average scores. So you can also take a look, if you are currently preparing for the DAT, what a good target score might look like to be a competitive applicant. So we've actually had several questions come in. So if you give me a quick second to kind of go through these. Earlier we mentioned had some discussion around a gap year or an enrichment year. So we had a follow-up question on that. What do you recommend students do during their gap year while they wait for admissions decisions, or to apply rather, I think?
I'll just briefly speak to that, maybe more from a theoretical standpoint, because I've just been asked this question over and over again as I visited campuses, and I'm sure that Dr. Miller and Ms. Goldfarb would agree. And so theoretically, for example, let's say we are having an applicant who is set to graduate in, let's say, maybe they just graduated, so they are the class of 2022 from, let's say, Texas State University as an example. And so they decided to take a gap year and they did not apply for enrollment year 22. They are going to enter the upcoming enrollment cycle, which would be enrollment year 23. So if you think of it being a gap year, it's more like the gap year would be more like their senior year at their university, correct? And so we are looking more like at everything that piles up that last year of college, right? If it's somebody who might be taking a longer gap year, maybe they are going to apply a full year after they graduate, that would be for the following enrollment cycle, then yeah, we do have a whole year to look at after that baccalaureate degree is given. And so I'm not giving I'm going to let my colleagues answer the rest of the question, but I just wanted to put that, to conceptualize the idea around a gap year. It really depends on when that gap year is happening. So.
And go ahead, Dr. Miller.
No, yeah, you first.
I think it's really important also, again, we're looking for one thing to do during the gap year, right? And we're trying to target this, like, tell me one thing to do and I can get into dental school. And so I think it's really important that you look at yourself holistically and look, did I struggle a little bit more in the sciences? So maybe I need to do a post-bac. Was I working all of the time and I wasn't able to really get in a lot of my community service? So maybe that's something I can focus on. I think it's really, really important that you, again, looking for ways to engage with people. So whatever that might be for you. And I think it's also important to do things that you're passionate about, because when you're passionate about them, and they can coincide with what we're looking for dentistry, then you're just a lot stronger applicant, because when you go to write about it and talk about it, it's something that you're really passionate about. So I think it's just really important. I've had students who had, a lower GPA in the sciences, and then they went and they did a master's of public health, or they did a master's in business. And so for us, I would say that was probably the wrong choice. Because they really needed to solidify their sciences. Now, if I have somebody who is really strong in the sciences, but super interested in public health, and then they want to go do a master's in public health and really work in that public health setting, that's great. That just is adding. So really take a look at yourself and where you think you might be a little bit deficient.
Yeah, and I totally agree. And the main thing is, like, for you to self-evaluate, look at your application and see what was missing. The other thing is, just to give you some other examples, in the past, there was an applicant who had like a 4.0, but this applicant didn't have very little shadowing and no community service. And although she had some interviews at the different schools, no one offered to her. And so she needed a gap year to make up for what she didn't have, which was the shadowing of dentists and also working with people. She had put all of her time and effort into getting a 4.0 during college, and we're looking for more well-rounded people that have the people skills and knowledge about dentistry. So that just kind of gives you another idea about, like, looking at what you are missing. I can tell you that usually people that have a gap between graduating and starting dental school, like at least a year, not just a semester, they need to usually do some kind of upper division biology courses to keep in that study mode and be really well prepared to hit the ground running when dental school starts. That's really important. So most people, they need to work after they finish college. So maybe you have a part-time job in a dental office and you're taking a couple of, like, 2 upper division biology classes, maybe immunology or histology or something that you didn't get a chance to get to while you were in college. Some people might need to spend some time on restudying for the DAT and improve that score. So it really depends, but you need to do something, and you need to use that section on the TMD-SAS application to tell us what your plan is. Because someone who's graduating and they don't tell us their plan, they're much less likely to get an interview than someone who maybe we know that they need to do some improvements, and they're planning on doing those improvements during the gap year. Yeah.
I think you may have also addressed this follow-up question that we had for older applicants with full-time jobs. Is it necessary to continue with the science coursework? Absolutely. Absolutely.
Enrique, can I add one thing about the gap year and just kind of generally
Please.
speaking? Dr. Miller said something that made me think about it. So, a lot of times we have students that on paper, their application look really great. And then they come in for the interview day and it's a struggle. It's a big struggle for them on the interview day. Now, when you look at the end goal of being a dentist, you have to be able to make your patients comfortable. You have to deal with their anxieties in the chair, different kinds of things like that. So I think it's also important, like if you're the kind of person that has a hard time talking to people, and that's okay. It doesn't mean that you can't ever be a dentist. But I think during that gap year, you really need to start focusing on opportunities where you're really engaging with people that you don't know very well and really working on that part of yourself. And I think that so many people focus on the application and then kind of forget about the interview day, just what is your weakness there? And you have a whole year to work on that.
Excellent. Thank you. And we have a follow-up question on gap years here. Is there a place on the TMDSS application where they can list that what they will be doing during a gap year? So, Dr. Miller, I believe you're the one that brought that up. Which section of the application do you look for that?
So I guess in the coursework area, you put, there's a place where they put their planned courses, whether they're still finishing college and finishing their degree or doing something after that. There's a chance to put the graduate courses too that they plan to take. And then, there's in the application part, I don't know what it looks like for the applicants, but what we see is at the very end of the application section that there's future or planned activities.
Mhm.
So if they plan to work in a dental office or do this or that volunteer thing or, whatever they're planning. So we look at that.
Yes, and I think you're referring to the chronology of activities that is
Okay.
generated after an applicant completes the personal biography section. It automatically generates that chronology, and it's just a quick snapshot of all of the activities the applicant has been involved in since high school, all the way into their planned matriculation. So that does include those planned activities. You mentioned the planned coursework, and also the optional essay might be another part where an applicant might talk about what their future plans would look like. If you are a reapplicant, there's also an additional essay where you can discuss what you've done to improve your application year over year. So make sure if you are reapplying to take a good look at what you want to communicate in that very short essay, because that is another section that alerts the schools that you have been proactive in making improvements. All right, we've got several more questions to get through. Let's change gears a little bit and talk about our letters of recommendation. For dental applicants, are there specific requirements? Does each school require 2 professors and a dentist, or 1 science professor, 1 dentist? Does it even matter?
So for San Antonio, we require 2 letters of recommendation or a packet from the health professions team at the university, and that packet from the health professions advising team is always most helpful to us. And similar to my comments on if there's a pre-dental society on a campus and we know there is one and the applicant has chosen not to become involved in that, the same thing applies here. Is if we know that it's a school with a strong health professions advising team and that's not presented to us, we kind of wonder. So again, that's our minimum standard, but just as kind of a follow information is that we really like to see the letter, one of them be from the health professions advising in San Antonio. It gives us a look into the applicant that we don't get elsewhere.
For us here at Hunt School of Dental Medicine, we don't actually have a specific requirement. We have 2 letters of recommendation, but number one, you know that you're going to be applying to some professional school. So I think it's important that you really work on at least having a professor that you've worked closely with and that knows you. We think it's really important to have people who know you very well, because we don't want the letters of recommendations being just a listing of your experiences and your resume, because we already see that. Again, your letter of recommendation is an opportunity for somebody who knows you well and sees you in a different scenario to be able to talk about who you are as a person and who you are in situations that might be difficult. And then as far as what the dentist goes, we don't require it with a dentist. But again, if you've had 100 hours of shadowing and you've been in a dentist's office and they're not willing to write you a letter of recommendation, it kind of makes us wonder, like, why? Why can't you get a dentist to write you a letter of recommendation? So I think we don't require it because we understand that everybody's situation is slightly different. But we also tend to get that because the other schools also do require it.
And we require 2 science professors or the committee, just like Dr. Lemke said. And just like Dr. Lemke said, we wonder if your university has a strong committee, then why you didn't go through them. So anyway, but I know that there's some really big universities that have a committee. So we're just expecting to see 2 science professors plus a dentist. And like Ms. Goldfarb said, the dentist that you've shadowed a lot, that knows you well, that can talk about your how you conducted yourself in their office and those kind of things. Those are very helpful. Yeah, that's it.
So I know somebody's going to ask this, so I have to follow up. Are individual letters looked at less favorably than a health professions packet?
Well, like I said, some universities, that's all they have. So we're used to seeing that. We're used to seeing 2 professors, and we prefer that they be science professors. And so I would say that a lot of the students that get into our program, they didn't have the committee letter, just because it either wasn't available, or maybe there were so many pre-med, pre-dental students that committee can't handle all of them. Mm-hmm. So we expect that's going to happen. But like Ms. Goldfarb said, it's very important that the people that you ask know you well enough to write a good, strong letter for you. That's more important. And then the other thing, it's not all about the people put a lot of emphasis on this. These are very important, but this is just one piece of your entire application. It's just part of it.
Thank you. And for those of you out there who are taking a look at preparing for this application cycle, I just want to share that we have a link to the letters of evaluation page for our dental schools. So you heard that some of the schools only require 2 letters. As dental applicants through TMDSAS, you may submit 1 health professions committee packet or 3 individual letters of evaluation. One of those evaluations should come from a dentist, and then applicants have the opportunity to submit an additional optional letter. So as you're preparing, right now is about the time when folks are flooding those biochem professors' inboxes with requests for letters. As you get ready for applying for this cycle, just make sure that you see the TMDSAS requirements. We aim to have a requirement that has an overarching requirements that meet the needs of our schools. And so make sure you follow the guidelines that we have listed there. We have a few questions regarding out-of-state applicants. So our first one here is from Caitlin. She attends TCU but is a Kansas resident. Do you have any advice for applying as an out-of-state applicant to stand out in a pool of Texas applicants?
So I'll start. I think one way to stand out is for you to apply through TMDSAS. I think maybe Dallas is the only dental school in Texas that's even taking the national applications. But even at our school, we would prefer that you use TMDSAS because it's a better application and we get more information about you. And that way, we'll know as much about you as the Texans. Usually, out-of-state people need to maybe have a higher GPA than usual, higher DAT scores than your average Texan. You have to do everything that everybody else does. And for our school, you also have to have some kind of tie to Texas, and attending TCU is a tie. So, yay, you've done that. So, anyway, also, we do have agreements with the neighboring states that do not have a dental school. And so that would be Arkansas and New Mexico. So we do look through the pool for students from those residents of those states.
I'm going to add on to Dr. Miller that for us here in El Paso, yes, we are very excited to have you as a connection to Texas. But we're going to add one more thing because people don't really know that El Paso is in Texas. So we're going to look for probably more of a connection to our area. Our area is, 83% Hispanic. We are right here on the border. So we are looking for some reason why you would want to come to dental school in El Paso. And that's a really important piece for us as well.
And then for San Antonio, slightly different than for my colleagues. We do not require somebody to have a connection to Texas. It's great if they do. We allow only up to 10% of our slots, similar to my colleagues here, same as my colleagues, for out-of-state residents. I would say that an out-of-state resident is competing, if you want to use that word, with other out-of-state residents at our school. And we do require out-of-state applicants to apply through TMDSAS, to show that they're serious about, us here in Texas. And there's no magic ingredient. I know everybody was looking for the magic ingredient. It's the same. We look at our out-of-state applicants exactly the same as the in-state applicants. There's not one iota of difference to the process, except that the slots available to those applicants are much restricted. And so therefore, I would say, for example, in our most recent pool, the average overall GPA is at least a 10th higher for our accepted out-of-state applicants, as well as the DAT is at least 1 full point higher for our out-of-state. So not hugely, but there's a difference.
All right, we have a question from a non-traditional applicant. First-time non-traditional applicant, would taking additional recommended courses like immunology make me competitive? I don't see how it would hurt.
Yes, I think it would. But it would make anybody competitive. It doesn't have to be a non-traditional applicant.
All right, another question here. If you saw an applicant did a majority of volunteering at a public library, would that be frowned upon, since it's not food bank related or common type of volunteering people usually do?
Well, in San Antonio, it's not frowned upon. I mean, all community service is great. I mean, that's great. You should not erase it from your application or feel bad that you did that. We would still be looking for that extra piece of like interpersonal community service, as well as health related volunteering. And, when you say you're volunteering at a public library, well, is it interpersonal? Are you reshelving books? Are you just sorting books for like the used book sale? At our school, we put a lot of value on interpersonal community service, because that tells us something about your ability to, interact with people, and that you are used to having people in that personal space, people that you don't know, that aren't your friends. And so, for us, it's not so much that volunteering at a public library is bad, but what's going on there. And again, we'd want to know that missing piece to kind of complete your application about doing something in related to health as well.
I was just going to add too, I agree with Dr. Lemke, but like at a food bank, you might be just sorting cans and not interacting, not talking to anybody. And at the library, you might be reading books to children and answering their questions. And so it is more about the people interaction and working on your people skills for general kind of volunteer work. And all of that is good.
And then I'm just going to tag on to that. I agree. But again, so much of it depends on how you explain it in your application. There's a little blurb, right? So if you don't explain what you actually did, it's it's easy to assume at the public library you were just shelving books, and it's easy to assume at the food bank that you were interacting with people. So it's really important. I know a lot of times you guys get tired and you're ready to be done with this application. And I think that's why it's important to do it in sections and pieces, because every single opportunity you have to write about the things that you've done is an opportunity for you to tell the committee or the people who are screening your applications a little bit more about yourself and something different.
Wonderful. And just to bring back some of the technicalities of our application, you do have 300 characters to discuss each activity, but each applicant also has 3 activities that they can identify as their top meaningful activities, and that grants them an additional 500 characters to discuss those activities. So you could have up to 800 characters to talk about any experience that you'd like the dental schools to take a closer look into. All right. So this is kind of a follow-up to our previous question. They would like to, love to, if not, and not mind living in any city in Texas. I think that's fantastic for any of us to hear. Is there any place to explain this in the application, perhaps the secondary? I do want to emphasize only Texas A&M School of Dentistry has a secondary application among the dental schools. And so perhaps Sid and Dr. Lemke, this question might be more for you. And then Dr. Miller, if you could share some insights about what the secondary application for Texas A&M looks like.
Okay, yeah, so I get the sense like El Paso, yes, you'll come to El Paso. So there's not a place that you say, yes, I'm willing to come to El Paso, because everybody will say that, right? I think the buzzwords is, you want to work in an underserved community. Everybody says that, and they want to help people. Everybody says that. So I think the way that we see it is when you highlight some of the things in your personal statement, are there ways that you can, that what you're saying is in alignment with our mission statement? I think it's also looking at your community service and all of your experiences as well, like trying to see, are you that kind of person that goes out and does things that might connect to the same kinds of activities that you might see here in El Paso. And that doesn't mean that you have to learn Spanish. I get that a lot. I'm learning Spanish. I'm teaching myself Spanish, but it's really about, are you the kind of person that is willing to take a risk? I mean, and not only are we in El Paso, but we're also a brand new school, right? And we're doing things just, a little bit differently. So are you that kind of person though, that wants to walk into a place where everything is taken care of? Like the organizations are there, the programming is there, or you're walking into a school where that's not really been established yet. So these are all things that we kind of look for because we are a new school in a city in West Texas.
And I would just add to that from our where we sit down here in San Antonio is that I very often see explained in the essay, why do you want to be a dentist, and what's your motivation for pursuing a career in dentistry, is often that is a topic that our applicants choose to discuss there. And so if that is important to you or something that you feel that you really want to share, that's a great place to do it. And it might even spark some interesting conversations in an interview if you were so granted. But, that to me, that would be my best advice, is just, use some of your essay space to discuss that.
Excellent. Thank you. Oh, Dr. Miller.
I was just going to say that I would just assume everybody that applies to all the schools, or you would be willing to live in that city where the school is. So, maybe there would be one that you would like to live in more than the other. But from your question here, it looks like that wherever you get in, you would like to go. And I think we would just all assume that. And then Enrique, you asked me about our secondary application. It's just very short, and there's no fee associated with it. It's just to get your information connected in our system with your TMDSAS application when we download it. There is a place where we added like an optional thing to tell us how the COVID pandemic affected you. And some people answer that and some people don't. Then there's another one that if you had to overcome some adversity in college, you could write about that too. And then we have, for our out-of-state applicants, there's a small essay where they can tell us why they want to go to dental school in Texas if they're an out-of-stater. So it's very short, and a lot of these essays you could also use on your TMDSAS like optional essay if you wanted to. In fact, a lot of people have cut and pasted this exact same thing on our secondary. So the secondary is just not a big deal. It's just to help us get everything together in one place.
Enrique, can I add one thing? Again, what Dr. Miller makes me think of something. So when she was talking about, the different essays, I think sometimes students make an assumption that, well, I really haven't had a hard life and I have no things that I've had to overcome. So they only fill out 2 of the essays instead of the 3. And so what I like to tell students is you've got to fill all 3 of them out. You've lost now an opportunity to tell us something about yourself. And maybe you haven't had where, you've had a death in the family or something horrible happen, but everybody has something to be able to tell about themselves as a way that they've shown that they've grown, that they've overcome some difficulties, whether that be, going off to college, leaving their family, or whether it be trying to pass their first college biology course. I think those are all very legitimate things to write about. And so students will skip and only fill in the 2 essays. So all 3 essays should be filled in.
Yeah, I totally agree on this. Thank you, Ms. Goldfarb, for bringing this up. The people that we interview, very few of them only have 2 essays. Mm-hmm. And so this is just kind of an indication to us of your motivation. Like, you weren't motivated enough to write another essay. This is a big deal, getting into dental school. So most of the people, because everything else in their application is going to be more what we're looking for. So anyway, that's just word to the wise. Do all of, even the one that says optional, it's not optional. Forget it. To do all of them.
Dr. Miller, I was about to say the exact same thing, that there was remarkable overlap between who we interviewed and who wrote all 3 essays. Remarkable. So yes, I agree.
Thank you. We are running short on time here, so I have some rapid fire questions if I could ask these of the group. First one we're going to ask is, will interviews this cycle be in person or virtual?
In person for tech.
San Antonio, I am hoping in person. We are actually going to be discussing that in our committee. That's a committee decision in a couple of weeks.
Yeah, same with us. We have a committee that will decide that. Yeah, so we haven't decided. But there will be, I'm sure, like with all of the schools, some way for you to come and visit our school, whether or not your interview is actually in person. I think there'll be some way for you to come to the school and see the campus and see the facility and all of that.
Dr. Miller, you perfectly anticipated the next rapid fire question. Are there going to be official on-campus visits available?
We'll be offering something, even if we continue to interview virtually, which I hope not, but it's always a possibility. We will be offering some kind of visit.
And we are getting ready to, we're offering open house tours like once a month here in the next few months. So please follow us on social media. And that's where a lot of it is being posted. And there'll be signups.
Excellent, thank you. And for our last rapid fire question here, this is one of our favorite topics. Anytime the dental schools and TMDSAs get together, this is always a topic of conversation. What is a good timing for an application to be submitted? Is it too late if somebody submits in July or in August, or does timing not matter? This is really helpful insight for current applicants who are about to start their application in a couple of weeks.
I'll go ahead and start. So I'm going to say, I think the most important thing is to make sure that when you submit an application, everything is in that application and you feel very comfortable that the application is a very good indication of who you are. So that being said, yes, submitting it early, that's good because it gets it out of the way. I have students ask me, I'm going to retake the DAT. Should I submit it before I retake the DAT? Well, if you're the kind of person that would like to get your application out of the way so you can focus solely on your studying for your DAT, then that's the answer. If you feel too stressed getting that in first before you study and take the DAT, then that's your answer. We have interviewed and accepted students that have come on our very last interview day. And we have interviewed and accepted students whose application came in later in the cycle. So again, I don't think that there's really a good answer for you're going to get in if you submit in July.
Agreed. It's the best time for you. When are you able to present yourself in the best light to us? And, as Ms. Goldfarb said, perhaps you were going to take an upper level science course in the first summer session. And, we would love to see that grade. Let's say that that's really going to bulk up how you look to us in regards to your academic rigor, then wait. And likewise, we get weak applications in May and great applications in October. So it's better to apply early, but not a deal breaker to apply later.
Yeah, I agree. Just keep in mind, though, that we do start interviewing in August. So if you haven't applied yet, you're not going to be considered for an early interview. And there are fewer people at the beginning. So you're being compared to fewer people. So you're more likely to get an interview maybe if you apply early. I don't want everybody to wait till the end. So so applying early is good. Make sure that it's totally complete. And there are some things, and Enrique, you can correct me if I'm wrong, that they can update some grades, right? And courses later.
Correct. So
Yeah.
at the end of each semester, applicants go in and update their grades. So you do have the ability to make those changes, but there aren't changes that can be made to every section. So, for
Right.
example, the activity section, if you take on a new activity or opted not to pursue a certain activity in those events, you would have to kind of keep track of those, and perhaps during interview day, bring a sheet that has some updates about your activities. And we do have a list of each section of the application and which can be updated after submitting, available in our application guide.
And Enrique, I know we're running out of time, but I just want to say when you guys know that you can update grades, please update grades. It's a little bit frustrating when I'm waiting on an applicant to see how they did in their summer classes, and I keep waiting and keep waiting and keep waiting. And then finally, I end up sending an email that says, do you have grades to update? But again, that kind of shows me like a little bit of a lack of responsibility and maybe not a full commitment to wanting to go to dental school.
All right. Well, we are right at the end of our panel with our dental schools. Before we head out, is there any last message you'd like to share with our upcoming applicants to dental school?
Yeah, just good luck, and we can't wait to read your applications.
Look
Be
forward to,
yourself.
yeah. Thank you, everyone. Great questions.
Wonderful. And so on behalf of Texas Tech, Health Science Center, El Paso, Hunt School of Dental Medicine, UT Health, San Antonio School of Dentistry, Texas A&M University School of Dentistry, and of course, missing today, Dr. Cooley from UT Health Houston School of Dentistry, and everybody here at TMDSAS and the Texas Health Education Service. We'd like to wish each of you all the best of luck. I hope that today you can see that we are ready and excited to help you throughout this application cycle if any questions come up. And please take full advantage of all of the resources available at your fingertips. If you have any questions about the application itself, go back on our YouTube channel and take a look at our dental application workshop that happened last week. The full recording is available. And of course, here at TMDSAS, you can reach us at info@tmdsas.com if we didn't get to your question. So thank you all so much, and we will see you in the application cycle. All right, thank you.